I was just listening to the press conference of the White House right now, and Mike Pence is like, we have made so much progress on testing.
More and more tests are being performed every day.
Where are they? Where are they?
Excuse me. The health department and CDC said I did not meet the criteria. I'm a healthcare worker. I got sick after taking care of a man that was diagnosed with severe respiratory distress with no known reason. The test they swabbed me for 2 days ago is being sent off now, and they said it should be back on Friday. It seems like this congestion has gotten worse. They had to stop the nebulizer treatments because they're not good with COVID-19. 9 days and I'm sicker than when I came in. I haven't been in the hospital with COPD and bronchitis in 6 years. But when I go in the hospital, even for an asthma attack, the first course of treatment is nebulizers. They can't give them to me because they don't have an available negative pressure room. If they would have just done the test, I would probably already be home. My family would be back at work, and I could possibly be back at work.
I called the county health department in San Luis Obispo, was given like total runaround, no answers. I finally spoke to my doctor's office and was told that they are getting a limited number of testing. They don't know how many on Friday. I just spoke with my doctor's office. I was supposed to go in and get screened to have a test at 3. I thought it was a test, but it was just screening. And because my fever isn't as high as their criteria right now, they're not going to give me a test. So there's that. Guess it's not happening.
There's like all these ripple effects happening that I feel both responsible for and not responsible for at the same time. My roommates have had to make hard decisions about whether or not they're going to go into work based on the potential diagnosis, and they have ultimately decided not to. They're all self-quarantining.
So I actually thought that I would get tested because I was in close contact with him. They couldn't test me for COVID because I wasn't an elderly person. And so she said it's safe to assume that I have COVID.
You know, I went through this entire like existential crisis of like feeling guilty about getting a test because I didn't feel like I was sick enough because I wasn't an inpatient in the hospital. And that's just not how it's not how it should operate. If you're sick, you should be able to get a test to see what's going on, you know, a test that should be widely available.
My feet warmers. Sophia, say hello. I still am crunky, but I've got all my medicines right there with COPD and bronchitis. The longer you go without breathing treatments, the more that crap packs up in your lungs. Now it's going to take me twice as long to get well. As a healthcare worker, I should have been tested right off the bat, because if they would have tested me on Monday, got the results back in a couple of days, I could have been home by Wednesday. 11 days, they tied up hospital resources, my family. I have 10 people that were out of work. The only way they're going to shut it down is to get those tests available to see who's got it and who's don't.